Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Diverticulitis Foods to avoid. The foods you eat may contribute to the development of diverticulitis. Additionally, certain foods may worsen or improve symptoms, such as abdominal discomfort, constipation, diarrhea, or gas. /r/n/r/n Healthcare providers generally recommend avoiding high-fiber foods during an episode of diverticulitis. Depending on the severity, you may need to avoid food entirely and go on a liquid diet until symptoms improve. /r/n/r/n Specific diet recommendations depend on your symptoms or if you are trying to prevent a diverticulitis flare. Once the diverticulitis is resolved, a high-fiber diet may help prevent future episodes. /r/n/r/n Illustration by Tara Anand for Verywell Health /r/n/r/n Diverticulosis is common as individuals age. Diverticula are pouches that form along your lower digestive tract, often in your colon. Diverticulosis is the name of the condition when you have diverticula. Diverticulosis may not cause any symptoms. /r/n/r/n However, diverticulitis is the name of the condition when the pouches become inflamed. If you develop diverticulitis, there are foods to avoid during a flare-up and foods to eat to help prevent the condition from returning. /r/n/r/n During an episode of diverticulitis, your healthcare provider may recommend you avoid all food and go on a clear liquid diet to rest your colon. Examples of what you can consume on a clear liquid diet include /r/n/r/n Once your symptoms begin to resolve, your provider may have you slowly reintroduce food. Initially, this will likely be foods that are low in fiber to reduce pressure on the GI tract. However, eventually, your provider may recommend consuming a diet high in fiber to prevent future cases of diverticulitis. /r/n/r/n When you're experiencing diverticulitis, your healthcare provider may recommend you avoid foods high in fiber for a few days. A low-fiber diet helps to reduce strain on the colon and reduce how much you poop. /r/n/r/n Examples of foods to avoid during acute diverticulitis include /r/n/r/n While fiber may help prevent future flare-ups of diverticulitis, high-fiber foods like a big salad are bad for diverticulitis when you are acutely ill. /r/n/r/n Instead, consider eating the following low-fiber foods to help you recover from diverticulitis. /r/n/r/n Once you recover from diverticulitis, your healthcare provider will likely recommend you go on a high-fiber diet to prevent future occurrences. /r/n/r/n While most healthcare providers don't recommend excluding foods to ward off diverticulitis, research suggests a typical Western diet high in fat and sugar and low in fiber may increase the risk of developing the condition. /r/n/r/n Some research suggests a diet high in processed and red meat could be a risk factor for diverticulitis. One study found that males who consumed the most red meat had a significantly increased risk of developing diverticulitis compared to those who consumed the least red meat per week. /r/n/r/n Some people find that avoiding high FODMAP foods, fermentable, oligosaccharides, disaccharides, monosaccharides, and polyols, which are types of carbohydrates, may help with symptoms of diverticulitis. Research suggests that a low FODMAP diet could lessen pressure in the colon and help diverticulitis. /r/n/r/n Some high FODMAP foods to avoid include /r/n/r/n Some low FODMAP foods to add to your diet include /r/n/r/n Fermentable foods are those containing certain carbohydrates, like fructans, oligosaccharides, disaccharides, and monosaccharides, that can ferment in the digestive tract, causing gas, bloating, and other symptoms that aggravate diverticulitis. /r/n/r/n Fermented foods are those that have fermented outside of the body, like pickles and yogurt, and contain bacteria and other microorganisms that are probiotic. Probiotics help maintain the normal balance of microorganisms in your digestive tract and are beneficial to people with diverticulitis. R/n/n greasy, high-fat foods or those loaded with sugar may prompt inflammation in the digestive system, which could cause stomach pain or other symptoms. R/n/n fried foods and potato chips are examples of high-fat foods. High-sugar foods include cakes, muffins, candy, and cookies. R/n/n no specific foods are known to trigger diverticulitis. Experts used to believe that eating popcorn, nuts, corn, and seeds could prompt an attack, but current research suggests this isn't the case. R/n/n a diet low in fiber may increase your risk of developing diverticulitis. If you've had the condition previously or you experience chronic symptoms, your healthcare provider may recommend a high-fiber diet. Fiber can help soften stools, so constipation is less likely. It may also lessen pressure in the colon, preventing diverticulitis flare-ups. R/n/n some foods that are high in fiber content include the following. R/n/n in addition to following a healthy, high-fiber diet, drinking enough fluids to help soften stool is essential. Try to consume at least 8 8-ounce servings of liquids each day. Daily exercise also promotes bowel movements and may prevent constipation. R/n/n current dietary guidelines suggest consuming 14 grams of fiber per 1,000 calories. If you follow a 2,000-calorie diet, that would add up to 28 grams of fiber a day. R/n/n people who have experienced diverticulitis are generally encouraged to eat a diet high in fiber and low in unhealthy fats, sugars, and red or processed meats. If you're having an acute attack, your healthcare provider may instruct you to follow a liquid diet and then progress to a low-fiber diet before slowly adding higher fiber foods back into your diet. R/n/n while no foods are strictly off limits, consult your healthcare provider about whether changing your dietary habits could help with diverticulitis episodes. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.